Hi there, my name is Gabby and I am your host for today. I'm founder of Diversity Alliance and co-founder of Diverse Speaker Bureau. And every month we have a different campaign that we are delving into, we are learning more about, that we are speaking with experts about, that we are interviewing those with lived experiences about. And this month it's all about mental health awareness, which for event professionals is a huge topic. It's been listed as one of the most stressful professions in the world. So it's in the top 5. I think like Google basically says, if you type in Google, how stressful is the events industry, they align it with jobs where you're at risk of death or danger. So it's a pretty stressful industry. And we are getting a lot better, I have to say, at recognizing these kind of challenges and stresses on our mental health and well-being. And there's some great organizations out there doing amazing things to support this within organizations and workplace and within the live event setting as well, including EventWell and Stress Matters. And you can tell that organizations are starting to take this a little bit more seriously now, and that they really are looking into how they can support their employees and also their delegates and attendees at events as well with their mental health and well-being, because otherwise how are we going to keep going? Like, it's not feasible, it's not doable. And I would definitely say that there is a bit of a hangover from the pandemic and the lockdowns. I'm certainly still feeling it. I think we're all kind of burying our head in the sand a little bit and trying to forget about it, particularly with how stressful, and I've used that word so many times, but you know what I mean, especially if you're in the events industry, with how difficult and challenging it was during the pandemic when we, most of us couldn't work. A lot of us lost our jobs and got made redundant. And there was a lot of pressure on those who were still working. And I don't know if we've addressed that yet. So I'm actually really excited to be inviting our guest speaker on just very shortly. I'm going to describe what I am wearing and what I look like. And so I'm wearing a red and blue leopard print dress. I've got my gold chain on. I've got my red lipstick on. I've got brown skin, long dark brownie blondie highlighted hair, beige background, and my plant chaz is also behind me. But enough of me. Now it's time to introduce our guest expert for this month's campaign. And I'm really, really excited to have this guest with us. Absolute powerhouse. You're going to learn a lot more about her, but she's like done TED Talks and she's been on the BBC and, phenomenal human being. It's going to share some really interesting insights around well-being in the workplace and events and some of the wonderful work that she's been doing and the observations as well through the work that she does. So without further ado, Jenny, please introduce yourself.
Thank you so much, Gabby. Thank you. So like you already mentioned, my name is Jenny. I am 27 years old. I am currently wearing a striped orange and white shirt with some brown glasses. My background is blurred and I am Black of African heritage. I'm actually Nigerian. And I'm 27 years old. So I'm really excited to be here speaking to you. In terms of my background, just a little bit, I'm an occupational therapist. So I've been qualified for almost 5 years. And I've worked mainly in psychiatric hospitals, psychiatric secure hospitals, which means that the patients that I work with have various mental health conditions, but on top of that, they also have a forensic history. So they might have previously been in prison, they might already be in prison. So I've done quite a few assessments inside of different prisons too. And I also work with those who have various neurodevelopmental conditions within school, so working with CAMs. So I think over the span of the couple of years that I've worked, I've tried to get myself in different areas, still within the mental health sector, which is, what I'm quite passionate about. Outside of that, which is my 9 to 5, I also run a organization called SASA, which is a mental health and neurodiversity service. We're still fairly small, but essentially what we do is we do specialized assessments like sensory profile assessments to support people with neurodiverse needs, whether you have a formal diagnosis or you don't have a formal diagnosis. That's absolutely fine, because I know how difficult it is to get an assessment nowadays. And yes, we want to sort of bridge that gap between assessments being, not as accessible because of the state of our health system at the moment and the cost of living crisis, and just ensuring that everyone has the right resources from an expert's perspective.
Do you have any kind of examples of any kind of like practical tips that our viewers and listeners could take away?
Yeah, I suppose, for example, sensory friendly materials or sensory friendly spaces. I think we were sort of talking earlier on about like certain football stadiums. I found out what it was, Manchester. I'm not into football that much, so I don't really know too much about the team, but Manchester, and I think Chelsea as well, have implemented having quite a few boxes that are specifically for those who have sensory needs. So sometimes you see the kids who maybe are more sensitive to loud noises, or even adults as well, that are able to go into that quiet space but still enjoy live football. And I thought that was amazing, because it's like, that's a practical, tangible sort of intervention that you can actually see. Also, maybe, like I said before, in terms of adaptations within the workplace, creating open communication in the event space. Maybe you're looking at like, what kind of guests are you having? Are you providing support for those who might be hard of hearing, for example? Even like, asking the guests that you, or the speakers, for example, to describe like what they're sort of wearing, especially if it's being recorded. I think that's amazing. So there's so many practical steps, but I think the issue is sometimes why it takes so long, or sometimes why people get it wrong, is because they're not getting those, maybe with lived experience, input in those decision making. Maybe not getting, like I said before, experts. It's not just, I think as well, and sometimes this annoys me, especially when I say I'm a therapist. They're like, oh yeah, so you do CBT or you do this. It's there's a whole heap of us in hospital settings, or whatever clinical settings. Obviously you've got psychologists, nurses, doctors. Those are what people mainly know. And I think it's also about educating yourself around, okay, what other types of therapists or health professionals that are specific to your needs, to your workplace needs, would be ergonomics, for example. A lot of people don't know that OTs work in ergonomics. So that's usually around like, you need seating adaptations or tables and all that kind of stuff. So, it's just, I think it's also about like, what are you willing to learn? What are you willing to do research on?
And what are you willing to put your money behind? Put your money where your mouth is. Don't try and do the bare min, so you can tick the box, but really nothing's really changed, because you don't want to invest in essentially your people.
And you're going to end up losing money anyway, like in terms of retaining staff. If they don't feel happy or don't feel supported in their place of employment, most likely they will leave, and you end up, like I said, losing more money. So why not spend money on these important resources, so that you're able to retain staff and you're able to continue building your business, or do whatever, and everybody's happy.
Yeah, exactly. And when I'm doing kind of like recruitment audits and offering advice around sort of talent development, retention and things like that, one of the key pieces at the end, I mean, hopefully you've managed to retain your employees ideally, but if you haven't, it is making sure to get that feedback during that exit interview of why that person is leaving, because this is the only way we're going to learn, isn't it? We might not want this particular feedback. It might be positive, it might not be, but we need to know where we're getting it right, where we're doing it right, but also where we can improve or where we're getting it wrong. I think a lot of companies bury their heads in the sand, and they're just like, well, that person wants to leave, bye, see ya, without actually finding out why. And we need to know the why, because we need to know what we need to put in place to, make those improvements and make the space inclusive and accessible. We ask our contributors if they have any kind of book recommendations. So I'm wondering if you had anything that you would share.
I'm just looking back at my bookshelf. Do you know what? At the moment I'm reading, it's such a good book, Confident and Killing It. I don't know if you've heard it, by Tiwa. And she's she's also a speaker, but her main topics are around confidence and, you know, self-belief. But the way that I don't know, there's just something around the way that she presents herself, because she talks about her experiences of low self-esteem and, you know, how she's been able to build it up, but also how sometimes she still dips even till this day. So it's quite an honest book, Confident and Killing It. I got it last year, but I need to sort of going around this year to reading it. And yeah, it's such a, like I said, realistic type of book where you can actually see yourself in it. It's not just about glorifying, you know, work hard, believe in yourself. No, it's actually saying, you know, giving you practical steps, which you can probably tell that I quite like, but also being honest about the fact that it's going to be up and down. You're going to have moments where you don't feel as confident. You know, she talks about imposter syndrome, which especially within the workplace, and sometimes the more senior you become, you'd be very surprised. A lot of people in senior positions, they still sort of suffer from imposter syndrome. So it's just having those honest conversations so that when you do reach that point, you don't feel like, oh, there's something wrong with me. Why am I feeling like this? So that's a really good book that I'm currently reading at the moment.
Nice. I like that a lot, because I think there's an inextricable link between self-esteem and well-being and all those things. But I think we also need to be mindful, particularly in big cities and you know, in the Western world, that we're making well-being kind of like, you know, like I've kind of mentioned it earlier, well-being privilege, in that not everybody wants to do yoga, not everybody has the ability to do all sorts of yoga, not everybody wants to do meditation, like all these kind of things that are thrown about now with what's good for well-being. And admittedly, I do all those things because I do find they help me, but they're not for everybody. So we need to make sure we have a variety of well-being kind of tools and resources and activities that are suitable for everyone, because not everyone's going to want to do yoga, meditation, mindfulness, tai chi, as amazing as they are. And for some people, those things can actually be quite expensive.
Absolutely.
You know, to take part in, or I don't know. So I think that we need to consider that.
Yeah, I think that's really important. Just knowing that there are several options out there, I think is great, because then you're able to sort of test and try out things. I've tried out meditation. I can't concentrate to save my life. I'm just like, you know, wandering off to different thoughts after 2 minutes. But it doesn't mean that I can't find something else. Like maybe I like playing tennis. For me, that helps me with my well-being, like being outside and, you know, those type of things. Some people like gardening. So like I said, just in the same way that there's different types of therapists for different types of needs, there's different types of you know, initiatives and practical things that you can do. You just need to sort of try and test it out. I think that's another thing, like testing things out. And the same with in the workplace as well. There might be some initiatives that might not necessarily work too well, but it's more about, okay, let's go back to the drawing board, let's bring in experts, let's bring in lived experiences, and let's see how we can move forward with it.
Beautiful. Thank you for that. I was just mute. That was hilarious. Jenny, thank you so much for your time and chatting with me today. I really enjoyed it. Thank you so much. And, you know, thank you for all the amazing work that you do.
Thank you. Thank you so much for having me. I really enjoyed this conversation.